most of you are graduating, right? And know a little bit about implants. Curious about implants. Yes, I've done implants since 1988. I'm an old man. But I'll just tell you a story. My graduation thesis at Harvard, you need to follow a case for 2 years and present a case to all the professors and all the every year we only graduate 24 students. So 23 students, and then all the professors and presenter, and we can listen to all the presenters killing the speakers. Everybody gets very nervous because that thesis, if you don't pass, you get failed for 1 year. So everybody gets killed, you know. So when it was my turn, I went up there, I present dental implants, 4 implants. It was a funny story because that patient came to me, no teeth, and I said, do you have a denture? No denture. I said, then what? When you don't go out, talking to that patient, you don't go out meetings, social? Yeah, I borrowed my brother's denture. So like 30 years ago, people think denture is like shoes. I can borrow shoes and go out party and take it back and give it back to my brother. So I thought it was an interesting story. So I told my professor, I'm gonna do 4 implants on him. Of course, I gave him options, 6 implants, 8 implants, 4 implants, 2 implants. So he picked 4. So I did 4 implants, I followed up for 2 years. So I went up to give my graduation thesis presentation. After I finished the presentation, nobody asked me questions. Not one professor, one. From a head of the school of public health. He raised his hand, asked me one question. What water do you use? I was in my head, I was like, clean water, what are you asking? I mean, dirty water? Is there something I did not know about water? So I said, oh, it's saline water. Okay. So next day, I'm telling you a story, this is just the history of the implants. Next day, the principal called me in. Leon, what did you do yesterday? Nothing. It was my turn to present my thesis, I presented. Why did you use the implant as your thesis? I thought, well, I thought that was okay. No, you cannot use the implant as your thesis. So we're gonna think of holding you back for 1 year. So at that time, I thought I did not get into all the questions asked. So I thought I passed that whole year. No, I had to get hold back 1 year. So I quickly, I was fast. So I quickly had so many cases. So I present another case, full mouth, with perio, with bridge, with all the fillings. I presented, so I passed. I graduated on time. So later I found out who the person failed me. I knew that guy. I said, oh, why did he fail? Because implant at that time wasn't a recognized, wasn't a mainstream. So you should not use implant as your graduation thesis. What I mean is, make story shorter. I opened up a teaching institute in Las Vegas. 16 years later, the guy flunked me, came to take my class. Learn how to do implants. Okay, and he is very famous at UC right now. But what I'm saying is, what you are getting to know about implants is about good timing right now. Okay, so I like to share with you because, I believe everything is meant for something. My 5 kids are here, and you'll take good care of them. So I thank you. Anyway, for me to return a favor, I think I should just share some of my experience, 30 years of experience. If you look at it, generation to generation, I got a little famous too fast. When I was 29, I got a little too famous. So the people who I was lecturing with, 1/4 of them are dead already at that time. So the second generation, and here's the 3rd generation, you are about dental implants. Back in my time, dental implants wasn't a screw. Dental implant looks like a blade. Okay, I'm not sure if you go Google it, it looks like a blade. Some dental implant look at subperiosteum, it's like a net, looks like a mesh. Okay, those are obsolete, those are gone. I call them a dinosaur. But some people start bringing that back. I don't know why, but anyway. What I want to share with all of you is today, is that you're all going to graduate and go out facing the world. I know most of you probably don't want to be a professor. Most of you just want to go back, start making money. I think that's what I was. I think that's what you're thinking of, right? So what you learn in dental school is good. It's good basic. But they are not going to make you millionaire. They are not. Whatever you learn in dental school is just basic. Get you out of trouble. That's all. But don't take me wrong. You're still going to get in trouble. Then you're going to say, well, no, school taught me this. So how are you going to, Your Honor, how are you going to, if you go to court, somebody sue you, patient sue you. Facing it, somebody will sue you. And then you're going to say, no, I did everything what school taught me. You're still going to lose. Or I have all the professor protect me. Come on, to be a witness. You're still going to lose. Why? You did not tell me I was out of work for 10 days. Patient was in pain. You didn't tell me. So patient going to sue you and they're going to win. And then you say, well, no, I don't want to be a dentist. Everything I do is wrong. No. Everything you do, communication. You need to talk to the patient. Don't just say, my professor said, my school taught me this is right. No. Patient going to say, I'm going to teach you lessons. Let's go to court and find out who's right. Okay? So who is right all the time? Patient. Patient is your boss. He paid the money. You listen to what he had to say. So one time I was in Japan. The Japanese periodontists, all the periodontists asked me, can you teach us for 2 hours lecture? I said, what the topic you want me to talk about? What's the future of the dental implants? I was like, why don't you ask a college professor? Why ask me? No, but you did the most implants. You know the future. Yes, I know the future. You know why I know the future? Patient tell me what to do, and I do what patient is my teacher. When you do implants, it takes an hour to do one implant. You numb the patient, you drill, you change another drill, you change another drill, you make the drill wider, wider, wider. I think you took some courses, right? And you have to watch the markings, make sure it's cool the bone. So you slowly, gently put the implant in. Okay, takes about 40 minutes to 1 hour. In between, patient may be bleeding, maybe coughing, maybe I need to go to the restroom. 5 minutes. So all that waste of time, right? 1 hour, finished. Then patient gonna say, why take so long? Well, that's what the school teach. That's what the company said. No, that's not a patient want. I want a less pain, successful, give me a quick result. Am I right? So patient is the future. Patient tell you what to do, that's the future. What do college do all the research paper for? What do all the statistic things, numbers? What for? For famous? No. For the fame, for the doctor, for the professor want to be have his salary raised? No. For the patient. What we do is just all for the patient. So a lot of people get very angry at me. I charge a lot on the patient for the one implant. I think it's worth it. I guarantee forever. I told the patient, I guarantee forever. And some patient, when I said that when I was 40 years old, the patient said, okay, forever, I'll pay. It's insurance. So nowadays, patient younger than me. I said, I guarantee forever. They looked at me, well, I'm 40, you're 55. You may be gone. I said, I have my son and daughter. They'll take care of you. Okay. So anyway, so I charge the patient. Okay, anyway. So I'm going to tell you a lot of the funny stories happening in my life. But what I want to share with you is open your mind. Open your mind. What I am going to share with you is so much information. But what I like is just make it simplify for you a little bit, so you understand implant is fun. It's very fun. Most of the doctor or professor or maybe some of your seniors will tell you implant is really difficult, scary, a lot of lawsuits, a lot of complications. No. Implant is so fun. Why am I say so fun is there's only 2 things in dentistry is so fun. Not doing root canal, not pulling teeth. Those are not fun. Why? Some of you, half of you probably partied yesterday, right? And you got so buzzed, right? You heard of pulling a wrong tooth. Probably you heard of that.
Yeah.
All the dentistry is irreversible. What I'm saying is you pull the wrong tooth, you cannot put it back. You're dead. Think of pay back the money. Think of it, just come down the patient, don't go to court. That's it. I know there's a technique that you can do a root canal and put the tooth right back in. Yes, you can, but usually don't last. Okay. So what I'm saying is, only two things are reversible in dentistry. Free gingival graft. What that is, you take another gum from the palate and you put it in here. It doesn't work. It grew again, so you take another piece of the gum. Reversible, right? So another thing is reversible. You probably never think of it. It's the implant. Implant is reversible. Why? You came to me with no teeth. I gave you a tooth. You came to me 0. I gave you 1. Right? And if that implant was crooked, you came to me 0 first. So I give you something. And you don't like it, I take it out. You're still back to where you were before, 0. Reversible. The bone grow back. What you sue me for? Some people say I charge you a lot. I say that all the time. They say, oh, you charge so much for one implant. I said, wait. You have 28 teeth. Yeah, beautiful teeth on the other. Okay. How much do you want me to charge you? I'll pay you. I'll pull one tooth out. A good, healthy, good tooth. From 1 to 0. Oh, that's priceless. Then I said, well, you came to me with 0. I gave you 1. That's priceless. You think of that way, implant is priceless. Am I right? Yeah. Okay, so be brave and be confident what you charge. Don't be afraid that, oh, I charge too much, that's not right. No. You went to dental school for 5 years, you work hard. Some people went to dental school for 10 years. Come on. You came to me 0, I gave you 1. That's priceless. Otherwise, I pull one of your tooth. I'll pay you. How much do you want? For $700? Okay. So anyway, what I want to share is the next slide. This is completely. Oh, do I do it myself? Yeah, you just. Okay. I want to share this. It's too far advanced for you guys, but I just want to share with you. That's happened 2 weeks ago. I did this case. Okay. Let's see. I think look at this one. This is a CT. This tooth is no good. Now you can see only 2-3 millimeter. As I move the CT around, you see the ridge is almost an eggshell. Very little bone left. Completely to 0. That's the front teeth. All the way to the front. A little bit more coming down, but that's nerve. Central nerve, okay? Incisal nerve. Then as we going back, but imagine all these ridge are all completely gone. The whole entire upper arch, eggshell, just really thin, like 1 to 2 millimeter. Impossible to do any implants. An infection here too. It's only thin 1 millimeter. He came to me in 2 hours. I did all the implants on his upper. All in one visit. Okay? Why did I do that? Because patient asked. Patient said, can you do it in one visit? The other doctor said, I had to do a bone graft. I had to wait 3 months or 6 months for the bone to heal. If not successful, I do bone graft again. And I had to wait another 4 or 5 months. Then I had to do sinus lift. I had to wait for another 8 months. And if all successful, then I'll put implants. That's how many months already passed by. That's how many surgeries. 4 surgeries, not guaranteed. 1.5 years passed by. Right? Another patient. This 2 implant was done by somebody else. Rest of it all failed by somebody else. 1 millimeter bone. Nothing here. Nothing. It's completely none. Oh, I'm sorry. How do you go back? Okay. 1 millimeter. Okay. No, I did all that. I'll finish. Okay. That's a really advanced case, but I just want to share with all of you, like, everything's possible. Everything's possible. You know what I mean? Ask you very simple questions. Who needs the implant? The patient who has missing teeth. Okay, who has the most missing teeth? Tell me. Healthy people or diabetes or systemic disease? Older people? Older. They all need dental implant. They are most likely. And they are what? They are the patient that we refuse to treat them. Oh, you have high blood pressure. Go get your pressure done first. Oh, no, you have diabetes. Get your diabetes under control and come back. We refuse them. So we do all the what? Easy cases. Or unless you're healthy, I'll do implants. So that's not right. Okay? What I did is I treat everybody when they walk in, how many implants do you want? They said 28. Okay, I'll give you 28. No, that's the Bible. It's just, we need to treat them. They need us. Okay? Anyway, I was on a lecture in the AAP back in 1998 to 2009, and I stopped giving lectures. And I'll tell you the reason why. But anyway, I try to get some common denominator with you guys because you're all European doctors. Oh, these are the European doctors coming to Boston to listen to what I was saying about the sinus repair. But anyway, back in Europeriod 4 in Berlin, I was a main speaker back then. I'm not sure right now, Europeriod how many, I don't know, maybe 28 or whatever. I'm old, that's back in 4. Every year they have it. Anyway, that's a European. There's some other speakers, probably some of you know, but anyway, I was the youngest being invited at that time. And these are you probably remember them, and they got older. Of course, I did not change much, anyway. That's Michael Jackson's father. He had 7 implants done somewhere else in Beverly Hills, and they all failed. So he came to us, and we took care of him, and he was happy on his neck, Alec, Nasdaq, Austria, And this the institute. I had me and Jennifer, Dr. Cha, their mother. We both built this institute. And you're welcome to visit. It's in Las Vegas, okay? Now, all of you are young. So whoever tells you, say, this is a new technique, be careful. Just remember, what is a new technique? What's an old technique? You probably don't know. You're too young and too fresh. Somebody say, this is new. You probably say, okay, it's new, I believe you. But just remember one thing. Anything somebody tell you, as long as less invasive, is a new technique. Just think of that. Less invasive is a new technique. Anything is so traumatic, takes so long, that's old technique. Let's think of it. Some of you play basketball, you know, you have a knee surgery. You know, a long time ago, we have a knee surgery when we have whatever the tendon being broke off. The incision is this big, a big suture marking. Now we do endoscope, no suture, right? People still can continue to play basketball. Same thing. Just remember this. The future is robotic, of course. If I say robotic, everyone thinks the future. Less invasive, atraumatic. That is the future too. I didn't write this. Somebody wrote it. Okay. So at school, if we're still doing blade implant or superior osteum, just look at it. Don't even try it, okay? It's a dinosaur. If somebody tell you something about, oh, it's so difficult to get osseointegration, it's not difficult. It's not difficult, okay? So what I'm saying is anybody say anything, you're young, you don't know what's new, what's old, they all exist at the same time. Just think of it. iPhone, people still using a little house phone. They still exist, okay? So they all coexist. Just think of it. Less invasive is a new technique. Okay, when I do a soft tissue surgery, people would ask, because I'm a periodontist, I don't do much soft tissue surgery anymore. Why? Why don't you do, you're a periodontist? I don't need to. Why? You have other doctor do it for you? No. I have other way to take care of it. Okay, I will share with you. I've done very little connective tissue graft or free gingival graft. But anyway, when somebody asks me to teach about the soft tissues, these are the 6 main topics I teach. Okay, we're not going to touch this. We don't have enough time. So I published some papers, and I want to share with you is that using endogain for soft tissue root coverage, I was the first one in the world did that. This article is approved. Okay, now there's a guy. I don't want to say his name. He is very famous. He said he was the first one. No, he wasn't, because when I was presenting the endogain with the root coverage, he was the one screaming. That's impossible. 2 years later, he does that. So anyway, it doesn't matter. Look at it before. Implant exposed. I'm not gonna share too much with this. I'm just give you a quick implant exposed. The other doctor advised take the implant out, bone graft, another gum graft, and then redo the implants. Textbook said. But let me ask you reality. The real reality, what happened? Who's gonna pay for this? The previous dentist. Am I right? You think patient gonna pay again to take the tooth out, put the implant out, bone graft, gum graft, and a new crown? Who's gonna pay for it? The guy who did this implant. So what I'm saying is, can we just not do anything? Just do a little gum graft? All patient want is just aesthetic. Am I right? So why make it ugly? But of course, if you hate that dentist, you can make it ugly. Just make that patient, hey, go sue him. You know, you have to pull that out, put bone graft, you know. Anyway, how about this? Oh, there's a root exposed, recession, gum recession. So we can do it with the vertical translation technique. Okay, this is in the article. How about something like this? Okay, we can also do the vertical translation to build that up. One surgery. Everything I do, just one surgery, finish everything. One time I have this doctor come to the Dental Implant Institute in Las Vegas and take a course from me. It was 50 doctors. They all pay to come here, and I feel like, oh man, I charge a lot. It's better, to share all my information with them. So this one doctor came, but every time we have a coffee break, he passed his business cards around. Come take my course. Come take my course in Atlanta, here, Georgia, Atlanta. I was like, wow, he's here using my course to advertising his course. So he came to me. He said, Dr. Chen, I want to share with you. How far are you booked in your appointment book? I booked for a year and a half. How about you? To me, I said, 2 weeks. Come take my course too. I teach you how to be very busy, and you book for a year and a half. I told him, you're too slow. Why I said that? Because patient comes in, I do it in one surgery finish. Why you book for a year and a half? Because you come here, I'll do extraction. I book for 3 months for bone graft. I book for 6 months for a sinus lift. I book you for a year later for soft tissue graft. A year and a half, I do implants. Of course you book for a year and a half. And he was shocked. Oh, well, everything is done in one visit. Okay. Now, what is the future? Okay. If we are still in this stage, no, we are not now. We are in the past. Okay. So what are we doing? We are closing to this type of implants now. Okay, then you can say, well, this type of implant, zirconia, I heard of it. It's just been around 10 years. No. It's been around for 20 plus years. Okay, because us, as a dentist, we are so conservative. We don't take things new quickly. Okay? So usually we still stay here. Implants been around for 70 years. Why are we still staying around here? This is the future. If somebody say they're going to do this, they're going to do this, they're going to do something like a cylinder, that's a past. Okay? How do I know the reason? Because it's hard for me to educate and teach, share with you guys. But anyway, you have to remember when you're in school, we remember textbook. Then we try to understand it, we try to apply it. Later, we try to make it and become an inventor. That's what we do. Okay? So I kind of, in the way, understand everything here, so I can start having some patents. Now, let me kind of share with you. Are all these still available? Yes. Yeah. So you are so new. If somebody say, hey, this is new, you dial and it can call someone. You may believe it too. But of course, you're not that slow. This is new. Come on. But if you don't know anything, somebody tell you, this is a new trade, you may believe it. It takes more guys. This is only take few people. You may believe it. Am I right? They are coexist. They are around. This is old, too fast, dangerous, too fast. This is slow, safer. Will you believe that? Maybe. right? So they are coexist. So what I'm sharing with you is just like understand what's new. And what's new? Time. Less surgery and then less invasive. That's new. Learning dental implants as operation manual take this thick. It's thicker than our biochemistry book. Do you want to do implants? But if we can make implants so simple, everything, and only just as thin as this little manual, do you want to do implant? Yes. So that's the reason I like to share with you how to do multiple function with one phone, not single function per item. Okay, so right now there are two types of idea. One is multiple function, means everything, all the surgery done in one visit, like what I'm going to share with you. There are single functions. You do extraction first, like the socket heel. You do bone graft later. You do scum graft later. That's a single function. Okay, are they all wrong and right? Doesn't matter. Whatever patient likes. Do you know how complicated my surgical kit is? That's it. I have a lot of nurses love to work for me because everything I do is just there. You know, not like, oh, you need to do sinus lift, I need another tray. You need to do implant, another tray. You need a gingival graft, another tray. No, everything just here. And with this little few instruments, I can do a oral enteral communication, fistula, 1 implant or 28 implant. All can be done in just one simple tray. Okay? Now, think of time. There are many people think of doing 4 implants. It takes 8 hours under general anesthesia. You rather to be this patient, or this patient has all the options of whatever implant you want. It takes only 2 hours under local. Tell me which one is new and which one is old. One time I shared this case. One doctor came to me. That's over-engineered. And I said to him, that's under-engineered. Okay? There's no standard. If that's over-engineered, why do we have 28 teeth that God made for us? God over-engineer us, man. Okay, let's look at this. 4 implants, 6 implants, 8 implants, 14, or many different brands. I call them implant orphans. Too many different brands. I don't know why. Maybe the patient switched to many doctors, or the doctor tried many different brands. So if he comes to you, what are you going to do? Nothing you can do, because some of the brand, the companies not even exist. You can eBay, they don't have the parts. Okay? So these are all my patents, but today I'm going to concentrate on 2 patents, or these 2. Okay? One is just a 1 drill system. 1 drill, that's 1 implant. Then a sinus implant. Okay? I'll just go quickly on that. Okay? They're called OsseoFuse.